You've got questions, we've got answers.
And I think that makes your pathway to university a lot easier.
The brain,
A voice.
Especially the first year if you pick the right subjects in year 11 and 12.
Information.
Here, and those signals run down through the spine.
Here in our studio, we'll be bringing you the answer to these questions and more. Join us for InfoMate.
Assalamu alaikum and welcome to another edition of InfoMate. Asthma kills around 1,000 people every day worldwide and affects as many as 339 million people. Today, to talk about asthma and the issues revolving around asthma, I have with me Dr. Nosheen Talpur Ahmed, a general practitioner from Sydney, who is a fellow of the Royal Australian College of General Practitioners, and Dr. Aisha Masood, who graduated from Griffith University in Queensland with a Doctor of Medicine and currently working as a resident medical officer in Queensland. Jazakallah Nosheen and Aisha for being here with us. How are you?
Jazakallah for inviting us in this program.
So my first question is, what is asthma? Why is it so common?
Asthma is actually a very common chest condition. It is very common worldwide. So what happens in it is actually there is temporary narrowing of the airways, which the airways are actually the breathing tubes in the lungs. And what happens is that they become oversensitive. When a person is having an asthma, then there are three things happening at the same time at the smaller level. And what happens is around the airways, the breathing tubes, there are little muscles. They constrict. Also, the wall of the breathing tubes, it become inflamed and swelled up, and they become thickened. And the third thing that happens is actually there is production of the mucus. So all these things lead to a person with asthma having shortness of breath or feeling difficulty in breathing. So this is what asthma is. And the second question you ask, how common it is. So in Australia, about 11% people have asthma. That is about 1 in 9 people. And if we talk about in numbers, it comes about 2.7 million people who have asthma. Yeah.
So how do you know you have asthma?
So basically, like Nosheen said, asthma affects the airways. It causes the inflammation. So the symptoms that one person will feel is if they're having shortness of breath, if they're having difficulty breathing, if they're having a long, persistent dry cough, also if they have a tightness in the chest, or if they have a wheezing sound. So this is like this high-pitched whistling sound that comes from the lungs. So generally, if they have a combination of these symptoms that are present, usually these symptoms come and go, but they are occurring at particular times of the day. So for example, at night, the symptoms are more worse, or someone may wake up with the symptoms. These are indicating that it's likely that they're associated with asthma. Also, asthma symptoms have a clear trigger. So they could be when exposed to smoking or pollution, or when exercising, you can have shortness of breath or cough. Or they may have these symptoms after coming in contact with dust mite, pollen, or other molds, and having a history of having asthma, family history, so having a mother or a sibling that has asthma is also a higher indication that you will likely have asthma as well. So when someone is exhibiting these sort of symptoms, it's good to see a doctor so they can rule out other causes for these symptoms, so things like whooping cough in children, or heart disease or COPD in adults. When you see the doctor, the way they diagnose asthma is they will do what's called a lung function test. So that's a spirometry test. We do this from the age of 6 years and above when the child can understand instructions. It just involves breathing into a tube, and that measures the amount of air that we can breathe out of our lungs and how fast we can breathe out. And then the test is then repeated after taking a bronchodilator, which is a medication that's used just to open the airways. And if the symptoms reverse, or if they get better after using this medication, then we know that the likelihood the patient has asthma.
Right, so you mentioned breathing related issues. So can people with asthma still exercise?
Of course. So it's important to remember that exercise is a very big trigger for asthma. And patients will likely experience symptoms like shortness of breath, wheeze, or cough 5 to 10 minutes after they've stopped doing exercise. And the main reason is that we all know that in exercise, your lungs are working harder. You're taking a deeper breath in, and so that's causing more workload on the lungs. Because of that, your lungs are already sensitive in asthmatic patients, so they're going to become more sensitive when you're breathing in air. Because of this, likelihood is that people will get the symptoms. However, there's ways we can prevent the symptoms, which can allow patients to actively participate in sports with asthma. So some of the tips that are recommended is to take the blue puffer, or the reliever medication, which is the bronchodilator, and take that around 30 minutes before exercise, and also take it after you finish exercising. It's also recommended to exercise in an environment where there isn't smoking, there's no other pollutants around that will irritate your lungs, and to try to breathe in through the nose when exercising, so the moist air will go into the lungs and make it less irritating.
So is asthma preventable altogether?
Well, asthma can be prevented to an extent. Obviously, as Aisha have mentioned and explored on the triggers that can make the asthma worse. So obviously, if we can avoid the pollutants in the air, and if we can avoid the smoking in the surrounding environment, if we can avoid the moles, the dust mites, obviously we can prevent it, as I say, to an extent. But the main thing is that we can definitely control it, and we can very well manage it if we know the right knowledge about the asthma. So that is the main thing. And even in that, if we don't know how to manage it well, then it can be very serious, and it can become very life-threatening. And we can see that from the statistics that around in 2015, 39,500 people in Australia were hospitalized due to severe asthma. And that's not just young kids. Actually, there are young adults there, even elderly there. So it's basically, the point is that we all need to know that how to manage it well, and how the asthma medications work, and when we should seek medical treatment. That is the most important factor. So as I say, it can be controlled and well managed in that way.
It's important to mention here, like Nosheen was saying, that there's been so many hospitalizations because of asthma. One of the statistics we do have is that back in 2017, there were around 441 deaths from asthma itself. And out of this, the alarming sign is that 300 of these deaths were actually females. And the majority were females aged between 55 to 65 years of age.
Sure.
So these are our end of middle age women that the likely contributing factors at that time, what we could pinpoint was likelihood that it's a lack of awareness of asthma, it's a lack of education, it's also not prioritizing their own health above their other responsibilities. So these women most likely have children of a young age, they have aging parents that they're looking after. So I think that's why it's good we're having a program like this where we're discussing how important it is, and hopefully people will become more aware.
Well, talking about awareness, asthma is viewed as a disability in many parts of the world. Is it actually a disability?
Well, I understand. Unfortunately, there is this stigma attached to asthma that it is a disability, but actually it is not. Because, as I said, if we can properly treat it in a timely manner, then definitely a person who have asthma can live a normal and an active life. So it is not a disability. The main thing is we need to know how to manage it. We need to be aware about it. We should take it seriously. I have seen a lot of presentations come to the practice, and they're teenagers and young adults, and they would think, oh, they were young, so they had asthma, now they've grown out of it, they don't feel any way wheezy or anything, so they think they have grown out of it, and they don't even care where their puffer is, when it expired. So there's so many factors. So these are the patients who are at most at risk. So that's why we need to educate them. The children, when they first present, like because with their parents, they're little, parents don't know what asthma is. Like we see sometimes the triggers happen after viral infection, and the parents think, oh, our child is having a fever, and they bring the child to the practice, and then we notice, oh, the child is having problem with breathing. Parents didn't even notice it because obviously they don't know what asthma is. So in that way, but once the parents know, then they just manage it the best way. Because as I said, it's awareness. So then they know how to manage it, then the children are safe. Because children really rely on their parents for the proper medication and the adjustment of the doses. But when they're adults, they are self-reliant on their medications. So then is the point that there are more risk, there are more hospitalizations happening at this age pattern, because they're the ones who need medications and they're not taking it. And then there's a peer pressure. The problem is, oh, you know, why should we be relying on puffers? You know, will we get addicted to it? So there's so many questions and myths around it that I think the people need to know.
So Dr. Aisha, how do we manage asthma?
So firstly, we need to identify how bad someone's asthma is. Okay, so we look at the symptoms and we define whether they're very severe or the intermittent symptoms. So intermittent symptoms mean that the patient is having shortness of breath or having a cough, but only very rarely in a week, and it's not affecting their daily activities. And then severe asthma is defined as having the symptoms all the time. The patient is very sick, they're short of breath, they're waking up at night with coughing and shortness of breath, and they're not able to do any of their daily activities. Then there's mild persistent asthma, so that is having the symptoms daily, like shortness of breath, but it's not affecting their routine activities and they don't have a persistent wheeze. So I think once we know what classification the patient's asthma is, how severe it is, then we can target treatment according to that level. So we have like a stepwise approach to managing asthma. The first medication that we use is called a bronchodilator. So all asthma medications come as inhalers. I have one here with me. So this is your Ventolin puffer. So it's just a bronchodilator. It will work by opening the airways and allow the patient to breathe more comfortably in and out. So it consists of it's got three parts to it, I'll just explain. It's got a canister which contains the medication that goes inside the actual case, and then it's got a mouthpiece to it. So this blue puffer is a reliever medication, and that's taken for patients that have these symptoms after it's been triggered by either post-exercise or going out and there's smoke in the environment, and if they need the medication then, or during flare-ups of asthma. Now, if the patient is having their symptoms, if they're feeling short of breath more than twice a week, then what we have to do is step the patient up to what's called an inhaled corticosteroid. So this medication, it has a steroid in it, so it reduces the inflammation of the linings of the lungs, and it allows the patient, it prevents actually any further attacks from happening of their asthma. Likewise, if the patient's still having symptoms, if it's still persisting, the medication is then available as a combination as well, and which is a purple-coloured puffer, and it has a long-acting bronchodilator in it as well. So that means that medication will last 12 hours and will relieve the patient from their symptoms for a much longer period of time. Now, I think at this point it's very important to mention that a lot of people think that you can become addicted to Ventolin, and they don't want to take their puffers too often just because they don't want to get used to it. It's very important to note that you can't become addicted to this medication. The medication acts very locally, so you're inhaling it, it works just in the lungs, it doesn't go into your blood. So it's very low side effects from the medication itself, and also there's no addiction associated with it. So it's a very safe medication to use.
And Dr. Aisha, I think it's a very good point to mention here as well. We can that with asthma, as we say, it's a reversible condition. So the Ventolin, it reverses the mechanism completely, isn't it? It opens up the airway so nicely. So that tells us that asthma does not damage the lungs. It's not a permanent damage there. Yes. It's a thing which can be managed properly with the puffer at the right time when it should be needed. Yes. Because if you need it and you don't have a puffer, that's a disaster. Yes. That's where we end up in hospitalizations, and unfortunately sometimes, occasionally, deaths can even happen. So that's the importance of the Ventolin. And there is only one side effect which is in comparison a bit common, and which is fast heart rate if you have taken it too much. Yeah. And still that is not as dangerous side effect. It's not deadly, you know. Instead, if you haven't had enough Ventolin, that will be more deadly for a asthmatic patient, rather than we are getting a faster heart rate, you know, which is not even a big issue. Yeah. So that's why we have to remove this stigma from people's mind that, oh, you know, what will happen if we use it more than we should have, you know. Yeah. So it's so simple treatment and so safe to use and so handy.
Dr. Aisha, you mentioned the devices used to manage asthma. Dr. Nosheen, could you demonstrate to us the correct technique to use those devices?
Sure, Amber. So we have this device which is a spacer. That is very important device in asthma that we all should use it. It should be used for young kids, for adults and elderly, everybody, because the effectiveness of it is as equivalent to nebulizers, which are usually used in emergency departments when a person is having a severe asthma attack. So how this works is actually it attaches to these puffers, which we call as MDIs. So they are all the three devices here. They all very nicely fit with it. So this is how it goes in, like that. And before we actually attach it, we should shake it nicely, and then we put it in. And then here is the person's mouth comes and seals, and then we press it and the person breathes in and out 6 times, and then have a break, breathe in normal room air. So this is how equal to 1 puff. So this is our reliever, which is very important to use in a severe asthma attack, or like if we want a quick action, we want a quick response, this is what we are going to use. But if we are talking about the preventers, as we talked in moderate to severe asthma is the stage where we need a preventer, then these are the 2 preventers. They are more for the younger age, and they are from the age of 12 that we can add this one. So they are usually used twice a day, but the same thing goes with the spacer.
Right.
Okay. And so I'm going to demonstrate it with Zaria. We have Zaria here. We are very lucky today. So I'm going to demonstrate how we can use it. So Zaria, I'm going to, suppose if you're using it for after a long time, then we have to prime the spacer first. So what we are going to do, we are going to spray it into it once like that, okay, so it seals around the walls, and at the second time you're going to seal your lips around the mouthpiece, very good, and I'm going to press it just once. Okay, now you breathe in and out 6 times, very nicely, very good, very good breathing. All right, now relax, now just breathe normally. That's right. So this is equal to 1 puff of the Ventolin, and that should be enough to help her open her airways. But usually it's the 2 puffs we need. So after that, after she breathes normally in room air, we can repeat the same thing again. Okay. So this is how we use it. So again, we also have another different thing, which is a preventer, and that is actually this one. So this is a replacer of this purple device. But this doesn't fit with the spacer, but this just fits with the spacer. So ideally, if we can stick with that, because the spacer, Ventolin, and the preventer, they all easily work together. So that's better.
So could you demonstrate to us how that is used?
Yeah. So this is it's just a once a day dose. So what you do, you just open it like that. So it just loads the medicine when this opens, and then here we have to seal the lips, and before that, we have to take a big breath out and then seal the lips, and then take a big breath in and then hold for a few seconds, and after that you can breathe normally. So that's the medicine goes in. So Zaria will do it for us. So Zaria, I'm going to close it. Now I'm going to open it. Okay, so you can seal your lips around. Very good. And big breath in. Very good. And hold. Good. Now when you can breathe normally. When you relax, very good, that's good. So this is how we can use this device, okay. But it's very important to know that the preventers take a long time to work. They can work in about roughly after 12 hours the maximum effect. So that's why they're twice a day, because they're giving us a 12-24-hour control. So if you are having a severe asthma symptoms, basically you need the reliever quickly. Dr. Aisha, so what is your idea? How should we address that issue? How to manage the severe asthma attack?
Yeah, so it's very important to identify the signs of who's having a very severe asthma attack compared to just an asthma flare-up. So the asthma flare-up itself is if the child or yourself, you're having just shortness of breath and having a cough, and this is maybe happening, but you're not exhausted, you're not drowsy, you're not struggling to breathe. And with an asthma flare-up, if they take 1 dose of their blue puffer, so take 2 puffs, for example, with the spacer device I know she just demonstrated, if the symptoms settle, then it's likely just an asthma flare-up and it's going to improve on its own within a few days. However, an asthma emergency, on the other hand, is very critical. It's important to note that if your child is drowsy, if they're exhausted, if they're not being able to complete their sentences, that you need to call an ambulance, and also to go through the first aid steps of an asthma emergency. So just to run everyone through, we have here is what's called the 4x4 rule. So you take 4 puffs of the blue one, the blue puffer, so this is the reliever medication. So you take 4 puffs every 4 minutes. So sit the child upright, give them 4 puffs, wait 4 minutes, see if the symptoms have improved. If they haven't, then dial 000, which is the emergency number in Australia, to call the ambulance and make sure that the patient is being seen by a doctor. It's very important that whichever country you live in, you are aware of the emergency number and what to dial in the case of an emergency. Yeah.
So where do I get more information if I want to know more about asthma?
There are a lot of resources. There's National Asthma Council Australia that you can get information from. They have a very good website. Also, Lung Foundation is there. There is Asthma Australia. They all are very good organizations, and we can rely on their information. Obviously, they're doing a lot of research constantly on the new management and new ways of treating asthma. Also, there is Severe Asthma Toolkit. It's a very good online resource. So that can tell us how our asthma is, how much severity at it is. So these are the very good informations that we can see.
So what would you say is the take-home message for our audiences?
Yeah, so I think it's very important that while we know that there is no cure for asthma, asthma can be well controlled and managed. And if it's managed well, then you can live a very complete, active and normal life. However, it's also important to know that if the symptoms are worsening and if your asthma is not controlled, it is life-threatening. So what I would suggest is if you yourself or your child is having any difficulty breathing, any symptoms of coughing or shortness of breath, then see a doctor, see medical advice, make sure that you don't have asthma. Also, for those that have diagnosed asthma, take your medications, take the preventer medication if you've been put on it, take it daily. And also have a good asthma action plan. So an asthma action plan is really just a document. It's instructions that a doctor writes. So it's written with your GP, your local doctor, and they just have instructions of the medications you're on currently and also what medications to take in the case of an emergency and how many to take, how much dose of each medication to take. So it's important to have an up-to-date asthma action plan as well.
Sure. And also it's very important to get flu vaccine, because flu vaccine is free for everybody who have asthma. So, and it's a very important trigger. One of the trigger of asthma is a viral infection, and which is almost the most common trigger that we see in general practice. So for that I would say definitely we should get flu vaccine, everybody. And the second thing is that it's important that we should carry our asthma medications at all time with us. Some people feel embarrassed to take them, like because of the spacer as well, because there's a big spacer, where to keep it, like the kids going to school. But that's very important. There is nothing to be shy of. And a lot of kids take it. Everybody in the school, the teachers, everybody gives a very good acceptance of people having asthma. They don't take it as a disability, definitely. So they should carry their medications. The other thing is we should never leave them in the car. Sometimes we think, oh, we'll leave them in the car, we'll just coming back. But the car temperatures can get very hot very quickly. So that's why never leave them there. It's better to keep a bag with you, with your puffers and your spacer, so that they're with you at all the times. The other thing is it's important to tell your doctor that what medications you're on. So they should know about each and every medications, even the herbal medications, because there are some medications that can interact with your asthma medications and they can actually make the asthma worse. So that's why that is important too. The other thing is smoking. So if somebody smokes in the home, that is really bad for asthma. And if the person smokes themselves, then they should quit smoking, because that's also one of the triggers and it can affect the lungs in a very bad way, and it's a trigger for asthma as well.
Well, Jazakallah, Dr. Aisha and Dr. Nashin, for being here with us and giving us such an informative session, and Jazakallah for helping us with our demonstration. Asthma is a very common condition and easily manageable and does not prevent you from leading a normal and an active life. Please be aware that the discussion we have today is only for educational purposes and to create an awareness about asthma. It is highly recommended that if you're having any symptoms of asthma, to consult a doctor. Thank you for watching, and we look forward to bringing you another production from MTA International Australia Studios. Jazakallah and Khuda Hafiz.